Hello, everyone. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. Every Friday, 1 p.m., I'm hosting Facebook Live, bringing specialists, experts, researchers, and parents from all over the world to share their expertise, their knowledge, the latest research with us parents, and also with many healthcare professionals from everywhere in Canada and worldwide. And today we are going to talk about ROP, Retinopathy of Prematurity. What it is, what does it occur, and the role of routine retinal screening for early detection and treatment of this condition to optimize vision outcomes. And I have here with me today Dr. Eugene Ng. Welcome, Dr. Eugene. Thank you so much for joining us here.
Hi, Fabiana.
He is a neonatologist and chief of newborn and developmental pediatrics at Sunnybrook Health Science Center in Toronto. He's an associate professor of pediatrics at the University of Toronto and associate scientist at Sunnybrook Research Institute. Dr. Ng is a strong supporter of family integrated care, and he has been an active supporter in NICU families by providing regular education sessions on a variety of topics. And we are so happy to have him here today. You can read his full bio on our posts and our website. Dr. Ng, what an honor to have you here with us, sharing your knowledge and expertise with families. We are very grateful.
Thank you, Fabiana, and welcome everyone. I'm so happy to be here, and thanks for inviting me to give a talk.
So I will let you share your screen now, and you can walk us through your presentation. At the end of your presentation, we're going to have a Q&A, so you feel free to ask your questions and comments, and we are going to address them at the end of this session.
That's great. So can you see my screen?
We can see your screen, yes.
Oh. Okay, so, thank you again for inviting me to talk. I'm not an ophthalmologist, who are doctor specializes in screening babies for ROP, but certainly as a neonatologist, I deal with this all the time. So I've decided to use a few slides mainly as pictures to show people what things are, and because it is very hard to talk about the eye without showing you some pictures to see exactly what do we mean by retinopathy and why does it occur and how do we prevent it and how do we treat it. So now if I can advance, there you go. So what is ROP, and for the sake of these, because retinopathy of prematurity is such a long term, we will use ROP as an acronym during this presentation. So I want to give a quick introduction. How do we know about this condition? This really started in the 1950s when premature babies are surviving because of the discovery of oxygen and to provide support for babies with breathing condition. Unfortunately, because of the liberal use of oxygen at the time, there's also an unintended consequence, which was discovered later, that many of these babies who are surviving lung disease ended up with visual impairment. So this come to a discovery of this condition called ROP, and it used to be called retrolental fibroplasia. But now, as we understand, it really is a disease of the retina. So, and again, so what do we mean by that? And so to understand that, I thought we should have a quick discussion on what we know of how we see. So that's the reason why I show you here a diagram of the eye, of the human eye. And there's a few parts that we should point out. And as you can imagine, light will pass through a series of apparatus, including the cornea and the lens, which is shown in the top here. And as it hits to the back of the eye, and the red part of the eye is
I think you have a problem with Dr. Eugene Ng's connection. I'm just going to wait a couple of minutes to see if he logs in back into the stream. I don't know if he realized that he came out of the stream. We are testing new technology today, so let's give him a moment.
So I think I'm back. Can you see me now? Can you see me now? Hi. Yeah, I can hear. Okay. So okay, I hope you can all hear me now. Okay. Good. Okay, so I hope you didn't miss too much, and I'm sorry for the technical difficulty. Okay, so what I wanted to maybe let's start talking about which babies are screened and when. We felt that the babies who are at the highest risk of developing ROP, which are the babies who are born at younger gestation, would need to be screened. And obviously, because as we'll talk about later, eye screening is not a pleasant procedure. We do not want to put every single baby through the examination unless we felt that they're at a higher risk of developing ROP. And the reason why screening is important is because babies cannot tell us whether they can see or not. And so if we do not screen for ROP, we would not be able to detect it. And obviously, early screening does make a difference because we can implement treatment which will affect the outcome. And so therefore, as much as they are unpleasant, they need to be done, and they need to be done at the right time. So as the current guideline states, all babies who are born with a birth weight of 1,500 grams or 1.5 kilogram or less than or equal to 30 weeks completed of gestation at birth are the group that needs to be screened. And because it is technically difficult to do the examination too soon, and also we also needed to spend some time for the blood vessels of the retina to develop. The first eye examination generally do not occur too early. And so it is stated here that either at 31 weeks corrected gestational age or 4 weeks after birth, whichever comes later, will be the time for the first eye examination. And here is a picture of one of our ophthalmologists, Dr. Curtis, examining a baby as he was doing his mission in India. But by and large, the examination is done by a specialist, in this case, an ophthalmologist who specializes in checking the retina of babies to examine babies' eyes. And, they are very skilled and usually quite gentle. But as you can imagine, having any baby going through eye examination is not necessarily comfortable. On the right are some of the instruments that they may use to open the eyelid so that the doctors can shine the instruments, which you can see here, directly into the retina, into the eye of the baby, where he can see the retina through his lens. And what typically a retina looks like will be like this. And if you remember the picture that I showed you earlier, this is the color of the retina, and this color is pretty red because it's full of blood vessels and it's very rich in blood flow. And out of this, this is the optic disc, which is really the area where the optic nerve originates. And that's also where the blood vessels of the retina start to develop. And so to understand ROP, and I also just, if I can summarize in one statement, the issue with ROP is the abnormal development of the blood vessels that lines the retina. That is the primary problem. So, but to understand fully what ROP is, we also have to understand how the blood vessels of the eye develop. And so if you look at it from a globe, as a three-dimensional globe of the eye, and here are some of the blood vessels that I can show you, just like the one in the picture, that originate from the optic nerve, or what we see from the image, the disc of the retina. And so as babies are born early, blood vessels will start to proliferate or grow from this center of origin in the optic disc, slowly through the entire retina towards the beginning, or towards the front. And so it comes in different stages. And so because ophthalmologists, when they have a picture, they have to have some convention that they can term everything exactly the same, so that when one person talks to another person, it's understood what exactly is the issue. They have divided the retina into 3 different zones. And so there's zone 1, zone 2, and zone 3. And most premature babies will start to grow the blood vessels sometimes during their shortly after birth. And by the time the blood vessels advances to zone 3, it will be around the time of the term-corrected gestation. So you can kind of see that to understand the condition of ROP, we also have to understand that these blood vessels will grow from zone 1 to zone 3, sometimes during the NICU stay for each baby. And so when ophthalmologists talk about different stages of ROP, the stages itself signal the severity of the eye disease, but it also had to be considering where the zone is at the time. Because if you can imagine, if a baby developed severe disease when the blood vessels only in zone 1, which means that by the time it matures to zone 2 or zone 3, you may get worsening of the disease, as opposed to a baby who has developed some disease of ROP when it already reached zone 3, when the blood vessels are almost fully mature, then the chance of it worsening will be less. And so we have to think about ROP not just in terms of the stages or the severity of the disease itself, but also in terms of where it is in the maturity. So that's why when we talk about ROP, we always talk about not just the stage, but the zone as well. And I hope everyone understands that. But if you have any questions that I can clarify, please ask when we're in a Q&A session. So the next few slides, I wanted to show you a little bit about what we think is the issue with ROP. So, you know, as I was alluding to earlier, ROP it relates to the disease of the blood vessels of the retina, and it has something to do with either oxygen exposure and also with lack of oxygen. So at some point, the baby's retina will stop growing, with the blood vessel will stop growing because of some sort of event. And that's sort of the beginning of what we call ROP. And so you can kind of see in the early stages, this is stage 1 of ROP, you will see a demarcation line, which is really the line where the blood vessels stop growing. So that's the early stage of ROP. So you can see that beyond the demarcation line, there's no more blood vessels. So this is the early stage. And when it gets to another stage, which is stage 2, you can start to see that ridge, that demarcation line, starting to form a ridge that is raised. And so that's another stage of ROP. And what actually happened with the blood vessels is as the disease become more severe, then the growth of the blood vessels become abnormal, so that they will grow much thicker and much more twisted, and in some way will start to pull the retina off the eye, which is so the second stage, where you can see that the ridge of elevation was that part of the retina has started to grow a little bit out of the plane. And when it get more advanced, then that ridge to become more proliferated, and in fact now by stage 3 you would see that the abnormal blood vessel will start to grow into the ridge or growing out. And so, and when it starts happening, the blood vessels could bleed and into the outside of the retina, into the liquid of the eye. And when that happens, scarring could occur. And then when it gets further into the stage of ROP, the retina could actually be pulled away from the eye. And so in stage 4 or stage 5 ROP, which thankfully we don't see very much of, you could have partial or full retinal detachment. And when the retina is detached from the eye, that is a high risk situation that may have caused visual impairment. So, let's talk a little bit about the convention, as we have spent some time talking about now the stages, and we talked about the zone. In order for ophthalmologists and neonatologists and other health practitioners to communicate properly, we have a set of convention. And so these are the typical sheets, and I'm not going to go through in detail, but you can still see ophthalmologists in our unit when they examine a baby to actually start to write down what they've found on these kinds of paper. And so when they talk to the next person, without the next person having to examine a baby's eye again, they could also tell what the findings were. And that's very important, especially when communicating to other specialists in regards to treatment and so on. Let's spend a little bit of time talking about treatment, because obviously it is an important piece. Now, thankfully, the majority of babies who had some level of ROP, maybe in stage 1, maybe in stage 2, they will get better without treatment. And when we get to stage 3, or that there is a disease, maybe stage 2, but it's really in just zone 1, and when the eye is not very mature, some doctors will decide to, 1, closely monitor the eyes, and 2, may decide to start treatment early. And and let's talk a little bit about what kind of treatment, because I think it really matters, especially as we advances on treatment for ROP, that early treatment may actually be more beneficial. So the gold standard, which is, until the last few years, at least the mainstay of treatment is by laser surgery. And now I'm not going to show you any picture about what laser surgery is about. It's a very specialized procedure, but what really happens is doctors will, under anesthesia, would use laser to burn off part of the good retina, or the retina that has not been affected by the disease, hoping that the eye disease will not advance there as the blood vessels grow into there. The problem, I mean, it's a obviously very effective treatment to combat visual impairment. But the problem with laser treatment also is that because you're burning off some part of the good tissues, you may actually end up having permanent loss of some vision, at least on the periphery, on the side. In the last few years, there have been many studies, and now it's slowly becoming a standard of care of using an in-eye injection. And as much as this looks and sounds horrible, it's actually a much more gentle treatment, if you will. Now, eye injection with a particular medication that is, we call it an antibody, and the common ones are also being used for adults. And these are specific medication that will regulate the growth of blood vessels in the eyes. So instead of burning off good tissues, they will actually make the blood vessels in the retina grow more regularly. So you can imagine that you would know that the outcome of using the in-eye injection may actually be far more successful in salvaging vision. And so now I think the last number of babies that we require treatment in our unit for sure is getting in-eye injections, because we felt that it would derive better outcomes. And obviously we need to study these for a longer time to be sure it is. But as our experience told us, babies are getting much more normal eye examination after the treatment. And so, but obviously to implement treatment, the baby also had to have enough eye disease to warrant these treatments. And so much of that is dictated by the eye specialists who are experienced in treating these eye disease. And sometimes, when babies are having moderate disease, but in early zones, like zone 1 and zone 2, they may require the treatment sooner. But certainly, if the baby advances to stage 3 or above, then obviously treatment will likely be warranted. And I want to spend some time talking also about outcome. And as we all know, most babies who have mild ROP in stage 1 and stage 2 will usually regress completely as time goes, and as further eye examination usually will see complete regression of the ROP. And obviously severe ROP may lead to significant visual problems, but with treatments, we hope that they will regress to the milder or moderate ROP and eventually resolve completely. So therefore, I have to emphasize that early detection and treatment is really very important. Now, I understand that you guys had a session with an optometrist more recently, and she had talked about some other eye condition, including refractive error, which is nearsightedness that may require glasses. It is actually very common in preterm babies, whether they have ROP or not. So that's kind of unrelated to ROP, but it is, I got asked those questions a lot, so it's probably worth talking about it. Now, I prepared a couple of more slides talking about visual development, and if we have time, Fabiana, I might just go through that quickly, but I understand that you may have had a session that talked about that before. So how we understand, and I talked, and this is really not related to ROP, but these questions come up almost at all sessions when I talk about ROP. It's when does visual development occur in preterm babies? And so we understand that before 30 weeks, most babies will keep their eyes closed. As you know, that many babies who are born between 23, 24, and 25 weeks, some of them may have their eyes completely fused, so their eyelids are not even open for a number of weeks. And when they open their eyes only very briefly, and they're really not focused on anything. And so by 30 weeks, they may respond to very bright lights, but not soft lights. And before 32 weeks, in fact, it is quite difficult for babies to control the amount of light that is entering the eyes. So therefore, from a developmental standpoint, it is quite important for us to either shield the eyes from bright lights, especially since babies are lying on the incubator, and there could be light shining directly onto the baby who cannot control the lights going into the eyes. And so it is important for us to dim the light. It's also important for us to shield the eyes, because you can imagine how uncomfortable that may be. In terms of how well they can see, and I got asked this question a lot, and this is things that I've found with the Snellen eye chart looking at visual acuity. As you know, perfect vision is 20/20. That means that if you can stand 20 feet in front of a particular eye chart, if you have perfect vision, you should be able to see it perfectly fine. So, you can imagine for babies who are less than a month of age, their vision is really quite poor. And because all they need to see is the mommy's breast. And that's the most important piece. And so their vision doesn't have to be very good for them to function. And so this is the estimate of the visual acuity in less than 1 month old baby is somewhere between 2,800 to 2,200. And as you know, 2,200 is the current definition for legal blindness. So really, their vision is not very good at that time. And as they grow, by 6 months of age, they will eventually reach perfect vision. So if you see a newborn that is not fixating on you as you were looking at the baby, it is perfectly normal. So that's the end of my talk. And I think I've covered most everything. I welcome any questions, because I'm sure there's lots of questions now.
Thank you, Dr. Ng, for this great presentation. I think it's such an important topic. And when we hear about ROP in the NICU, it's a very scary condition for parents to hear. I remember when my son was in the NICU and I saw his ROP progressing, and we had to actually do the intervention. We chose the injections. We were given the option back 8 years ago. And the injections was fairly new in Canada. So we had a lot of conversations with ophthalmologists, which option we should take. And I'm very happy that we chose the injections, because Gabriel today has a 20/20 vision. We still go for follow-up appointments at sick kids every year now, but it was great. And how far we have come in this area, right? Because we do know that it was one of the leading cause of blindness in babies around the world. So I believe in Canada, this is no longer a reality, is it?
That's right. So ROP, I mean, it's felt to be a leading cause of visual impairment in developed countries. And it's not because it's more common in here. It's in developing countries, especially in third world countries, I think the eye infection, it predominates the cause of visual impairment in children. So therefore, in Canada or in the United States, where those kinds of situations are not as common, then ROP remain an important cause of visual impairment in children. However, because of the advance in treatment, in advances in treatment, we now feel that we're getting this under control. And obviously, we look at the rate of severe ROP regularly across the country, and we know that the incidence is slowly decreasing in a nice way. And part of it probably is because of the advances in treatment, but also importantly is the early detection and the screening.
Absolutely, this is so very important. So now let's talk about the babies who did not get to stage 3. They had a mild ROP. Do they still have to be followed after the discharge from the NICU?
I think so. There's a certain peak of when ROP will develop, and that's usually close to the time of full or full-term gestation corrected. Now, I mean, so when most babies leave the NICU if they are almost near term, you would think that the incidence of developing ROP after discharge is quite unlikely. But if you have mild stages of ROP, you would like to follow it to be sure that it will continue to regress. But the other pieces that are important for eye doctors to look for will be the other things that are common in babies, as I was alluded to earlier, with refractive error like nearsightedness or short-sightedness. And also, some premature babies are at risk of having, and I hate the term lazy eye, but strabismus, which really is the imbalance of the eye muscle that causes the eye to not be focusing at the same time. And those kind of conditions are very specialized and need a specialized doctor to check it and to treat it. And so having eye examination after discharge is still very important.
Absolutely. So how about the babies who actually had the procedures, either the laser or the injections? How long they have to be followed up by specialists? Because I know for the injection, it does keep the holes in the retina, and that could be a potential reason for a retinal detachment. So how long those follow-ups go for?
I think it's variable, but I think a few years, it's certainly not unreasonable. Now, I mean, we also have to think about the resources, because, and as you know, especially in our city, that there's not a whole lot of retinal specialists who knows how to look after these babies. And so many times, especially if you live in a more remote community, that may actually mean a trip to a tertiary care center like the Hospital for Sick Children. And that's a lot. And so at some point, I think, when the eye disease is at a more stable condition that people are not so worried, the eye specialists get actually started to transition these care to a more local ophthalmologist who just do more general eye examinations. So it's actually hard to see. I think it's case by case in terms of how long do you keep checking the retina. Because, once it's no longer become a problem, then you may sort of let more generalists start to do the follow-up. And so, but again, when the child gets older, then some other issues may become more prominent. So that's also required some follow-up. And, I guess you can tell me by your experience of how long the relationship with an eye doctor may be, and sometimes it could last the whole childhood, right?
Absolutely. Well, for us, we are on a 2-year window to go to see kids for ophthalmology, but also my husband's an optometrist, so he kind of take over a little bit of the eye health of our kids. So we are privileged that way. But I think it's very important for families who do live remotely or rural areas to keep those appointments and find a way to get the baby to be checked, because it's a very important continuous of care after the NICU. Yeah.
Now, I mean, the resources of retinal specialists is actually a countrywide problem because there's really not a lot of retinal specialists, and we have lots of babies to be examined. And so, in some remote communities that I know of, such as in Sudbury, for example, there are satellite programs. And what happens is, there is no eye specialist who knows how to deal with premature babies up there. But they do have a camera called a RetCam, where you can train a non-ophthalmologist, usually a nurse or someone who is technically skilled, to take an image of the eye and send it directly to a specialist down at Sick Kids or somewhere else. And they can look at the image, interpret it, and that's one way for continuing follow-up to happen.
Absolutely. The technology is really helping us at this time of, distancing from big urban centers. Doctor, one more question, because parents always are very anxious the day of the eye exam in the NICU, because we know the babies can have spells that day, they don't do well that day. Can parents get involved during the eye exam to comfort the baby, to support the baby during the examination?
That's a very good question, Fabiana. So, and obviously, and maybe I didn't really talk too much about it. The eye exam is an uncomfortable procedure. And so, what happens with the eye exam, for those of you who have not had the experience of it, babies will need dilating eye drops first. And the dilating eye drops would obviously allow more light to go in. And we felt that, it's just like when you had the dilated drops before your eye exam, you would feel that light is you're much more sensitive to light. And so to comfort the baby by, putting an eye shield or just to dim the light will be important. And knowing that the baby is going through an uncomfortable procedure, having parents there to comfort as you would normally do is that much more important. Now, I mean, to be expected after a stressful procedure like that, some babies may have more spells. And so, for what we generally do is to make sure that we don't lump in other investigations or tests or procedures on the same day, knowing that this may actually be stressful enough for the baby. And and obviously, the eye drops and the effect of the examination may last for hours after, if not the entire day. And so, I think putting in somewhat more comfort or nurturing encounter or measures, especially by parents, even singing, talking, touching, those kinds of things are important, and not to mention kangaroo care.
Absolutely. We have a question here from our live audience. In case of retinal detachment, how are you managing, and is encircling the eyeball will work?
Well, I mean, I don't have experience with that, but I think the treatment for retinal detachment for adults and for children may well be similar. And please don't quote me on that, because I really, first of all, it's fortunate that I have not experienced one in my patients over the last many years. But I would imagine that the procedure for treating retinal detachment with surgical, putting the air bubble in to, put the retina back into the back of the eye, those kinds of things may well be similar. But I really, and maybe it's a good thing that I have not experienced it, because that just means our patients are not having these complications.
Absolutely. Dr. Eugene Ng, thank you so much for joining us here today. It was a pleasure talking to you, and he will be back in December to talk about infections in the NICU.
Absolutely. Looking forward to it. Thank you so much for having me today.
Thank you so
Bye-bye.
much. And for all of you watching us at home, thank you so much for joining us here today. It is November, and it's World Prematurity Day coming up in just a week and a half. And CPBF has joined the global efforts on the illumination program. We have 26 monuments across Canada confirmed to be lit up in purple on November the 17th. So you can go in front of the monuments, take pictures, and share on our social media. You can use our hashtag World Prematurity Day or PremiPower Canada. And we want social media to be purple that day to really raise awareness on the cause that is so very important to our community. You can check our website to see which monuments in your city will be purple that day. Also, from November 16th to November 20th, I'll be hosting PremiPower Week, which is a full week of Facebook Live with people from all over the world joining us and see what is happening around the world in the NICUs and what is the future in neonatology. We're going to bring people to talk about parental presence in the NICU during the pandemic. All the information is on our website, and I'll be live every day from 12 p.m. Eastern Time here on Facebook and our YouTube channel. Also, now in November, we have partnered with Pampers on a beautiful campaign called Pampers for Preemies. In November and December, every time you use the hashtag Pampers for Preemies, Pampers will donate one extra diaper to Canadian ICUs through the Canadian Premature Babies Foundation. You can join the conversation and share your words of encouragement for parents using the hashtag Pampers for Preemies. I will be back next Friday. And just a reminder that all the sessions that I've done since March when the pandemic started are recorded and available on our website, which is the CanadianPreemies.org. Thank you everyone for watching us, and I see you next week. Stay well.